Today we'll like to discuss a breath holding spell, which is a common behavioral problem in children, and it usually occurs at 2 years of age. So it peaks at 2 years of age and usually abate by 5 years of age. And how this breath holding spell occurs is there is some provoking event or there is some provocation that leads to the anger and frustration in the child. Suppose you snatch a toy from the child. That will lead to the anger and frustration in him, and ultimately he will start crying. And sometimes that cry stops at full expiration, and the child will hold the breath and will become the apneic and also may become cyanotic or pale. And if that episode is sometimes prolonged or you hold the child upside, so the blood may pool and there will be less blood to the brain and the child may become the unconscious and hypotonic. Now, the common differentials we need to differentiate from the breath holding spells are seizures and arrhythmias. Now, how you will differentiate the seizures and arrhythmias? So, we will take a proper history, and when we will take the proper history, there will be history of some provoking event or provocation, and also there will be a typical stereotyped pattern of events. And what we need to do is we need how we will manage this breath holding spell is we will reassure the parents. Another thing we will do is we will tell them to be consistent in their behavior. They should not fulfill all the demands of the child, or they should not make such event happen again. So they should be consistent in their behavior. Also, while the spell or while the event, they should not pick up the child up. That will make the child unconscious. And also, they should remain calm during the event. Another common behavioral problem which occurs in children very commonly. And suppose कोई मदर आती है ओपीडी में, मदर सेज कि बच्चा जो है वो मिट्टी खा रहा है 2-3 months से, तो that suggests the child is having pica. Now, how you will define the pica is pica is ingestion of a non-nutritive substance like plaster, charcoal, or soil for at least 1 month, which is inappropriate for the child's development. And usually ये 5 years से छोटे बच्चों में हमको मिलता है. And there are associated factors like which leads to the pica, like iron deficiency, malnutrition, developmental delay, or poor socioeconomic status. Sometimes psychosocial stress and other behavioral problems can also lead to the pica. Now, when the child is eating that non-nutritive substance in the form of the plaster or soil, he's at risk of developing the parasitic infections, as well as he's at the risk of developing lead poisoning. So, how you will manage this child is, first of all, we need, it's a behavioral problem. So, what we need to do is we need to do the behavioral modification. Then, if the psychosocial stress has led to the pica, so we need to alleviate that stress in the child. Another thing, iron deficiency, if there, we need to give the iron supplementation. And the risk which has been developed by the pica, that were parasitic infection and lead poisoning. So we need to do the deworming in the child, as well as we need to screen thumb sucking. So thumb sucking is a very common entity. If it is occurring in a child who is less than 4 years, we need to do nothing. We will just reassure the parents. It's a very common problem in infants and toddlers, and usually peaks by 18 months. But it will abate by the time. But if the child is more than 4 years, then we need to motivate the child to refrain the habit. We may use a positive reinforcement or we may use a negative reinforcement for getting rid of this habit, because it is socially unacceptable. And another thing is prolonged thumb sucking can lead to